Broadcasting around the world on the worldwide. In your face, all over the place. We're online 24/7. 24/7. You're listening to the hottest internet station.
Good evening, good evening, good evening. What a wonderful evening we have today. Good evening, good evening. This is In His Grace and Mercy. I am Pastor Kekana. I am Dr. Kekana. Good evening. We have In His Grace and Mercy Enlightenment Corner on Sauma HD Radio. It's from 7 p.m. till 9 p.m. On In His Grace and Mercy. I am your host for tonight. You find us live on www.saumahdradio.co.za. You also find us live on our social media platforms on YouTube, on Instagram, on Facebook. The handle is In His Grace and Mercy. Today we are talking mental health. We're saying mental health matters. And I have an expert with me in the studio joining us from a virtual stereo on a telephone line for those that are watching listening from Sauma HD Radio. For those that are looking at the video feed, she's right here in the studio with me. So when you want to tune in, ask questions, there is platforms where you can ask questions. You can ask questions on Facebook, you can ask questions on YouTube, and also on Instagram. So you just dial in the handle is In His Grace and Mercy. So this evening we'll be talking about schizophrenia, one of the psychiatric conditions that a lot of people might confuse as buloi, to some that believe in that. But we want to enlighten you today. That's why the Enlightenment Corner, so that we can be able to talk about such things. We can be able to ask questions. You can also ask questions on WhatsApp. We've got a WhatsApp line. You can send a voice note. You can send a WhatsApp message on the number 076-386-7025. 706-386-7025. Sorry about that. So I'm going to introduce our speaker for tonight, who is going to, educate us, and we can hear how we diagnose, how we treat, and where are the point of contact where we can ask questions and everything. So, Anastasia, good evening. And before you answer any questions, just introduce yourself. Tell us a bit about the work that you do. Who are you? Where you work? How can we get hold of you? And then answer this first question for us. What is schizophrenia? And how do we see schizophrenia? But you must introduce yourself so that we know who you are, where you're from, and all those things, so that we don't introduce you briefly and underrate whatever work you're doing in the space. So introduce yourself to the fullest.
Okay.
Good evening. Over to you.
Good evening, everyone. Good evening, everyone. I hope I'm audible. Thank you for the opportunity, Doc and Pastor Kikana.
You are audible.
My name is Anastasia Tlapani. I am a registered counselor specializing in mental health, of course. I am one person who is very passionate about mental health. Currently, I am practicing in private practice as a counselor. And then my passion also, I am a person who is a motivational, transformational coach and practitioner of NLP. And I do a lot of workshops on mental health, personal development, and trauma and youth development as well. I also am a speaker on different platforms wherein I do awareness on youth issues and women issues. So, in brief, that is who I am, and I love working with people overall.
Okay. Thank you so much. Thank you. And we are honored
Yes.
that you accepted the invite from In His Grace and Mason Enlightenment Corner.
Thank
And
you.
thank you. What is schizophrenia? Let's get right down to it. What is schizophrenia? How do we see it? And stuff. Tell us more about schizophrenia before I ask questions that will give you headache.
You are welcome. Schizophrenia is one of those mental health conditions where it is basically diagnosed by a psychiatrist. That's the specialty of a psychiatrist. However, how we explain schizophrenia, it's a mental disorder. It is
Yeah.
something that usually in its manifestation, it disturbs how the person thinks. It disturbs how the person interprets how they feel. It also manifests in the way they behave. And basically, it is something that has got to do with the chemicals in the brain. So there's a disturbance in the brain that makes this person behave in this particular way. And usually, this kind of behavior, we will notice it more into how the person thinks, how the person speaks, how the person navigates in his environment. And that will give, when the psychiatrist would be evaluating this kind of a person, would then come to a conclusion that whatever they are observing, it shows or it indicates that this person has got a diagnosis of schizophrenia.
All right.
And usually,
Um,
yeah, and usually the causes of schizophrenia, if we'd go a little bit into that, it is, as we're saying, it's a disturbance, it's a malfunction of the brain, the chemical imbalances in the brain. So sometimes it's caused by the environmental factors, extreme environmental factors, of course, like traumas, like overuse of drugs or substances. But most importantly, it is also a genetic um you are predisposed genetically to have a condition of schizophrenia.
okay. So now,
Mhm.
I wanted to ask you now, with the schizophrenia, can one, can they become aggressive in how they think? And two, is there any criteria you use that you can say one box ticked, one box ticked, therefore this person is most likely having a schizophrenia? And thirdly, are there any other types of schizophrenia, or schizophrenia from right top to the bottom? So your input, please.
To say somebody is, you don't tick only one box. It is a combination of the manifestations. As I said, you will listen to how this person presents with a speech. You will see how this person navigates in the space. I can just say a few of the symptoms that you would see, that you'd say, or you'd suspect as a layperson, and saying, I would suspect this person is not functioning like a normal person. There's a few things that happen that a psychiatrist would be looking at. You know, this person on the onset might just neglect their own personal hygiene, might just stop taking care of their work or their school work. This person's attention may be decreased. You know, sometimes it's sudden, sometimes it's gradual. Sometimes the thought processes of this person are disturbed in such a way that, you know, there's this part that you can see that they are hearing voices and they are responding, but it is in an illogical way for any other normal person, as would say. But a person who'd be displaying the tendencies of schizophrenia might even be believing what he is hearing, and these things in psychological or psychiatric terms could be said that they are delusions or hallucinations. This person may be hearing voices. This person may be feeling, you know, olfactory, how they taste things. They may be feeling that. This person may be suspicious of their environment, that people are there to kill him or her. And this person may be, you know, a grandiose. When we say grandiose, he's bigger than big itself. You know, it might display a behavior like that. Sometimes they say, as big as they are, they want to impersonate probably a religious figure and say, some of them, they say, I'm Jesus, for instance. You know, they would say that. But in their logical expression, it's got illogical, you know, levels that are very confusing. And that also, you know, sometimes with the behavior, somebody might just, others would just climb on top of a rooftop and say, I can fly. You know, these are kind of the behaviors when they see that they are not things that a normal person would really, or an ordinary person would do that. And in their environment as well, there would be a lot of disorganization, you know, disorganization of speech, disorganization of the environment, disorganization or incoherency in how they respond or how they express themselves. Sometimes they make up words of their own. So, in a way, the way they present, they can't really relate easily on the same logical level with other people. So there are quite a number of things that are needed to be observed for a diagnosis to be made. And that usually the specialist who deals with that specifically would be a psychiatrist. So us as counselors and some of other mental health professionals, we would suspect seeing the behaviors that are reported on, and then we would refer for confirmation of the diagnosis to a psychiatrist.
Good. Let me tell you, we're live on Sauma HD Radio. It's www.saumahdradios.co.za. I am Pastor Kekana. I am Dr. Kekana. We are talking mental health. If you just joined us and you are free to ask questions, you are free to send in your comment. Firstly, I would want to refer, when you have time, there is a movie called Beautiful Minds. I think it's kind of oldish movie. Obviously, yeah. If you look at me, you realize I'm talking about an old movie. So it's a kind of an oldish movie, but it actually portrays a character who was on the movie Gladiator as a mental health, patient who started becoming mentally ill while he was at the university. So just watch that. You will see what sort of an organized schizophrenic person is, who's not going to come out to be aggressive, who's going to come out to be solid, believing in whatever that is wrong up until so late in life, when he realizes that what he sees, people that he sees do not grow, but he's the only one who's growing. That's only when he realizes that he's hallucinating. So one, when you are hallucinating is when you are hearing things that other people don't hear. So if you hear somebody answering and you don't hear who spoke, you must suspect that. And if somebody has some delusions, okay, so delusions, it's easy. So hallucinations can be in many ways, can be in all the senses actually you have. You can see something that people don't see, and you can hear things that people don't hear. You can also smell something that people don't smell. So all that says is that you are in one situation, but you are thinking you are somewhere, and the situation, whatever that you think you are at, other people don't see it. You know, I hope it makes it easy, you know, to not try to use more medical terms. So therefore, when somebody is hallucinating, the only correction they have is that somebody to interrogate what they say and they see, which can also be difficult, because if I believe I see a car and you say you don't see it, it might be an argument. That's why some of them become aggressive. So then delusions. Delusion is when somebody starts thinking that, for example, you are the president of the country, or you think that you are a supernatural human being, to say, listen, I can fly, or to think that, you know, I can be able to talk to a machine. You know, I remember when I was training long time ago, as an undergrad, as I was training, there was a boy who believed that he can talk to an ATM to give him money and everything. So those are delusions. And then you also have somebody who's disorganized, you know, in their thought process, in how they do things. So it is not only about a person being aggressive, but the certain things that you see, these are not in keeping with what a normal person would do. Then you start suspecting. But for you as a lame person, you can suspect and go and ask for help. So while I still lost my aspect, I can tell you there's a DSM-5 criteria that you can actually check things that you're worried about. So DSM-5 criteria will tell you a person who meets the criteria of schizophrenia must have certain things for a certain time. So let's now treat this thing that somebody starts today and they're incoherent, they have hallucinations, they have this awkward behavior. You cannot, you know, right there and there diagnose them as having schizophrenia, because it has to meet a certain criteria of the number of days, how long that has been. That's one. Secondly, you have to exclude the fact that they might take in any illicit drugs. So therefore, even alcohol itself as a drug, or any illicit drug, these commercial drugs that people have, they can cause schizophrenia first time or in a long term, right? So that is those drugs that can cause, from as little as taking alcohol there and there. Later on, you are predisposing yourself to developing a mental condition compared to an average person who does not use whatever drugs that you're talking about, or that I'm talking about, whatever drug that you're taking. So that's one. So then when you have met those criteria that are in a DSM-5, and then also you have the number of symptoms for however duration it is, then you can have that diagnosis. But remember, the diagnosis can't just be made by anybody else. When you're a lame person, you can suspect, and the person can be taken to a general practitioner, a family general practitioner, or any other hospital, where they can be assessed for 72 hours to try and see if whatever that they have or presented with is being reversed, or is reversible, or it's persistent, where they can then make that diagnosis. So it's not as easy as that to try and make a diagnosis of schizophrenia. You also have to exclude many things that we spoke about. I remember last time when we had a neurologist and another psychologist, we spoke about delirium and delusion. So one has to exclude those things, that the person is not delirious, meaning that they are not withdrawing from alcohol. People are withdrawing from alcohol, they show certain behaviors. People are withdrawing from a smoke, they show certain behavior. So all those things have to be excluded, and they can only be excluded in an institution that is empowered or equipped to do such. So you cannot rather make that diagnosis from home. You can suspect. That is why when people have this diagnosis, by the time they get to a health professional, person or practitioner, they've been through many interventions to say no, and everything and stuff. So all those things People don't make those diagnoses, because depending on the level of your knowledge. So therefore, mental health, it's actually much more bigger than you think. Thank you for joining us back in the studio. And I can tell you, mental health is one of those conditions that you cannot look at a person and say, yo, this person is sick. So that is why you need somebody who is a mental professional, or somebody who specializes in that, to say this is the extent. Because it's not like when you have a cut and you're bleeding, somebody can see that you are bleeding. So that's something that somebody can go on with, and they say, no, oh, it's like that. This is how the person is. But actually, the person can get help. The person can be treated and now be reincorporated into the community as one of the contributors of the community. So therefore, whatever you do, don't forget that when somebody does not behave well, and you just dismiss it and say, this is how the person has been, get them to be assessed, get them to be treated. So today we talk about schizophrenia, but you would understand that there's also personality disorder that is coming with psychosis. So mental health is actually quite big, but people don't understand. As simple as a personality is, it can be toxic. Last we're talking about people who are narcissists, and that is something that later on you can imagine. If somebody is narcissistic and then they become psychotic, it's something else. So I wanted to ask you, thank you for coming back. I wanted to ask you, how long can a person present with symptoms that are indicative of schizophrenia on DSM-5 criteria? How long will it qualify for you to say, now you have a clean diagnosis of schizophrenia?
Doc, as we were saying, when there's a possibility that it could have been a gradual development into the diagnosis of schizophrenia. And some of them, as we say, the onset becomes at the time when they are just entering university, or just at the, highlight of their youth, around ages of between 16 to 25 to 35, where the myth of being saying you are being bewitched, it all many times applies. But to say the duration specific, it would be a period of 3 to 6 months, basically. But as we say, some of them, because of the genetic predisposition, it can be just a sudden onset, that from one time when this young person was not aware that they are undergoing so much pressure, and then because they're not coping so well, and that's the basic predisposition, the genetic one is present, then when it comes like the person has a breakdown, it can also become sudden. On others, like the ones who would be gradually abusing strong drugs or substances, it is a gradual deterioration of the brain formation, that when it has developed to a certain point, then this person's brain constituency changes, and then he displays these behaviors we're talking about. So it can be on both sides, but then you'd have to notice this particular kind of thought processes and behaviors. For some, it's sudden. For some, it's gradual. At least 3 to 6 months when the person is displaying this kind of behaviors.
Okay, thank you for cleaning that information. Now, when somebody has what we suspect, because if you're not a doctor, you can't make such a diagnosis. When you suspect, which other places that a person can go to report or present the person? Secondly, is it curable or treatable? This
Okay,
condition.
with the way South African health system works, we usually say the primary health caregiver, which would be the clinic, when you suspect this kind of behaviors, would be the one to contain the individual primarily. And from the primary health center, they would refer to a hospital where we've got our specialists, psychiatrists and psychologists, the psychiatrist who would diagnose and certify the patient as such. So the way to go, first of all, it is to go to the primary health center when the family member or a loved one or a neighbor suspects that the behavior that they are noticing in this person is suspicious of the criterion that we're looking at currently. And if it's treatable, it is manageable, because when the brain chemistry is disturbed, and as it is, it might not get back to the normal physiological state, but it is manageable because it's a chemical imbalance. So they manage it. That is why also in the therapeutic approach, it is the psychiatrist who will manage with the medication, as we said, specialized medication for schizophrenia, psychosis, and then they work hand in hand with a clinical psychologist who is specialized in a behavior modification for this person to be able to adapt in the environment where he or she lives. Some of these patients, they are in such a progressed way that they would be in institutions for the rest of their lives. Like we see some of the people who in that state might have made offenses or grievous offenses and might just be within mental health with people who have offended, like vescopies, and then it becomes a state patient. Sometimes this person is taken from the community because they have offended. They go to court and then they are assessed, and it's discovered that this person mental functioning qualifies them for this stage. And then this kind of people become state patients and they stay in institutions like Vescopis for us in Pretoria.
Thank you. We always say that we have MDT, so which is multidisciplinary team approach. So this is one of those conditions where you have multidisciplinary team from also even occupational therapists also involved to try and reincorporate the person back to the community. So this is manageable. It is not curable.
It is manageable.
But there is other, obviously the first and foremost, the causes, if they are not physiological, needs to be stopped so that you get to recover quite quickly to the maximum you can. So if then a person this is caused by a gradual taking of alcohol, and you see that the people that they take alcohol for so long that they start being incoherent, and people don't realize that because this is how they used to them ever since. And such things causes you to have a mental condition. So therefore, one, you can, the government and the private institution offers help for such things. If a person is aggressive, you are able to call the police to bring the person to hospital where they will be, sort of managed in terms of their anger and be admitted and treated for the condition that they have. So you don't have, to sort of avoid calling the police on them to be able to be, contained. Some people go, when you realize that this person is actually psychotic, they go into, they're breaking things and they're breaking windows and stuff. So those things that you see that you used to ignore. And one of the criteria as well in DSM-5 is that they have disorganized speech. So when somebody has disorganized speech, don't just take it for granted, or nonsense, or as you used to say, don't take that for granted. Get the person the help, because the sad thing about the mental health is that the person who's suffering from a mental health condition, they don't see themselves. The very same judgment they use to say this is appropriate, this is not appropriate, is the one that is sick. The same way that you cannot say, I will take 2 glasses or 3 glasses of drink, and when I start getting drunk, I will stop. The very same thing you used to say if you are drunk or not is a very much brain that you are plastering with alcohol, and then your decision making becomes skewed. Because when you were sober, you're saying you'll see yourself when you're getting drunk, but actually when you do get drunk, you don't see yourself because your mind is not the same way it was. The same way. If you understand that part, you understand what I mean. So tell me, in this hierarchy of management, which one is your role? Are people able to come to you directly to consult? Are people able to contact you and ask questions? In this hierarchy of mental health, which one is your role? Tell us more about your role in this, because somebody might have a question and say, you know, I have a question, and then later they realize they needed to ask something, or they need to consult or bring somebody for consultation, because not everyone with schizophrenia is aggressive. Like I said, if you watch the movie Beautiful Minds, you'll realize that not everyone is aggressive. So you can still have somebody who's not aggressive, who can go with you if you talk to them and they are willing to be assessed. You know, can we find you? Where do we find you? And what do you do?
You know, being at the in the hierarchy of mental health professionals, at the beginning, when the people are suspecting the behavior that they may not be understanding, it would be advisable, yes, they can pass through us as registered counselors. When we understand that it is not within our scope of practice, because unfortunately, there is no way a person with schizophrenia can be managed by a registered counselor. This person, that he has to find medication. So even if they come as the first contact, we will assess, see the behaviors that are being presented, and refer further to the psychiatrist. I work with the primary health mental care. I do all the basic containment, all the noticing of the behavior somebody wants to be clarified in or assisted in, stress, anxiety, acute stress, depression. And when the person needs admission, like clinical depression, like psychiatric diagnosis like this one, then we refer to a psychiatrist. I am not in a position with my category as the scope of practice to practice as a psychiatrist. This because it needs clear medical diagnosis, we refer to the psychiatrist. Yes, I have a private practice in the north of Pretoria, in Uber Estate, Pretoria North, and Hercules. So even in Attridgeville. So a person can, when they suspect that there's a behavior of somebody they don't understand, primarily contact me. And then from there on, when we realize we have to refer, then we work with other, as you said, MDT, multidisciplinary teams. We've got psychologists that we refer to. We've got social workers that we refer to in case a case needs also family assessment and support, because also patients like this, they need the basic family structure to be the support system for them. So would also need in that team of managing the person to have a social worker to assist in the managing of this person. But the utmost person that works and contains and therapy wise, that would be the psychiatrist.
Thank you so much. We are in His Grace and Mercy Enlightenment Corner. I am Dr. Kekana. We are now talking schizophrenia this evening, mental health Thursday. We are dissecting the issue. We are outlining it so that you can understand it. You don't start fighting people when they are not having a organized speech with you and they're behaving as if something is wrong. your first point of contact is to try and get help for that person, not a knee-jerk reflex of trying to fight the person who's sick, while you should be helping them. And we know that schizophrenia needs so many things that needs to be in place, and so many specialists that are specializing in different things, but that are pertaining to mental health. So I wanted to ask you, we know that the social worker has a role for the family in terms of making sure that the family situation or the family environment is conducive for somebody with schizophrenia. We also know that the families, by the time they bring this person with schizophrenia, they might have been affected negatively, so because they might have had a loss of property, they might have a loss of money. Some of them, their health might have been risked by this person who was hallucinating. Some are traumatized because this person possibly was hearing the voices saying he must kill himself, and he attempted to kill himself multiple times. So then you can imagine that the family would need therapy. That's where the counselors and the social workers work with families to reincorporate this person back to the family when they come back or when they're fit to be discharged. So family is actually also a bigger contributor in terms of the wellness of the mental health of the patient. So it's important that the person is discharged back to the family that understands what they're going through. So the family also get help in that situation of a person who is schizophrenic when they had other issues with the family before they got treated. Another thing that is very important is this. If somebody at your home, they try to kill themselves, it's not something that you can call uncle and brush it off. There is many things that is happening with a person who attempted suicide, and it's very serious. It's either it's the last bit of depression. So, but whoever tries to hang themselves, there is no way that they should remain at home, because they will try again, and this time they will succeed. So it's either they are on the last stage of depression. We always said when we're undergrad and when we're doing psychiatry that suicide is almost the end stage of a person who also believe that they cannot be helped. So you cannot keep such a person in your home. You are not equipped to keep such a person at home, because whichever way you look at it, they will need medication. Because when you try to kill yourself, you must have heard that killing yourself is a better solution. So in that case, you need a psychologist to bring you back. When you try and kill yourself, you have decided that it's better to live, it's better to die than to live. You need a psychologist or somebody who's going to deal with you and counsel you and show you the benefit of being alive. When you try and kill yourself, it could be that you are hearing voices that you believe that once you kill yourself, it will be better for you. You are going somewhere where it's better. So somebody trying to kill themselves is not something that you should, or even somebody says, I tried killing myself a few weeks ago. That is a red flag for you to say we have to go and need help. Remember, once you are diagnosed with a mental condition, you are most likely, depending on which one it is, but most of them, you are most likely going to need medication for lifetime, because that is something that cannot be corrected once you are wired that way, right? So therefore, you cannot deal with it on one facet by talking to them, by making them happy. You know, if somebody's depressed by the way they're being treated at home, by just changing your behavior will not possibly get the person out of depression. You need some medication to readjust some chemical response in the brain so that they can now become a normal person. So I hope by dealing with this segment this evening, and I ran out of time, I need to wrap this up. So, on a wrap up, parting shots that you have for us, Bese, we wrap up this segment for today on In His Grace and Mercy Enlightenment Corner. Let me tell you, such issues don't have as high numbers as things that are not building us as a community. Just do your part, like, subscribe, and share. And I can tell you, when you share, this won't take a lot of your data anyway, or it won't have a virus on your phone. We need such things as people. We need to embark on things that grow us, because there are certain things that you might not think you need now. You might need them later for yourself, for your family member, for your colleague. You will need them. I always say you cannot conquer the world with nothing in your head. You won't fly very far. Parting shot, before I take the stage, I'm a speaker for a living.
Yes, like me and you the same. Anyway, I'll just like to say to friends and families of people having issues with mental health to take them seriously, to be the basic support for our brothers and sisters. There is no person who is useless. I would like to say, let us destigmatize this thing of, in our language, say, "Motho wa gafa." Moto is experiencing things that also they are not understanding sometimes what is going on with them. And there is no redundant person with God. As you are God-based publication, there is no useless. Every person in our lives serves a purpose in his or her own right. So let us support them. Let us take them to places where, in our supporting means and efforts, are taking them to the places where they can get help. And help is out there, especially in these days that we are living in. Mental health issues are growing daily because our challenges are now more than ever. The lifestyles that we are engaging in, especially our young people, because as for we speaking of schizophrenia today, to say schizophrenia ke boloi, it is witchcraft. It happens a lot. And I've been in villages where you find people being killed just because they behave in a way that other people don't understand. Because when the onset time is a time when the young people are actually in university. And then you find that this person grew up relatively normal, sometimes even outperforming himself or herself. And now his first year, second year in university, then he gets this breakdown. It's not buloy, it is not witchcraft, but it says, look at what is happening. And another thing, as we're saying, it's genetic. We also search around the family when we assess to say, was there ever somebody around your family who had ever been either diagnosed or displayed the same kind of behavior? Because sometimes that is the thing that will also show that, you know, people who are displaying this with schizophrenia, it's not only starting with this particular individual. Somewhere in the genetic line, there was somebody, unkulu, tatumkulu, or mamukulu, who had something like this. And it is very important for the families to narrate to the younger ones to say that, you know, the mental health history is also important when the psychiatrists are evaluating what is going on with a person. Help is out there. You can come to me. I'm in at Trishville, Oasis Medical Center next to Adelaide. I'm in Nkwe Estate in the surgery there. I am also in Hercules. My phone numbers are 076 55 25320. Then we can assist. If it's somebody who needs further assistance that we can refer to, or if it's somebody that we can manage with any issue that they are experiencing, I am available readily to assist. And thank you for this opportunity today.
Thank you. Thank you so much. We really appreciate your time and your expertise tonight on In His Grace and Mercy. Let me pray. Bese Siavala. We got into this in an unusual manner because of the network frustration. But let me pray then. Bese Sivala Lento. Dear Lord, thank you so much, Mudimu. We thank you, Father Lord. We thank you. We thank you for the power that will, Lord, bless her and be with her, Lord. We call this, we ask this in a humble name, the beautiful name, the name above all name, the name of our Lord Jesus Christ. Amen. I am Dr. Kekana. I am Pastor Kekana. Let's meet on Sauma HD Radio, www.saumahdradios.co.za. Let's meet on Sunday between 7 a.m. till 9 a.m. on In His Grace and Mercy, where we preach the gospel of Jesus Christ. And then we'll be back again on Thursday. I think we might be having a book corner. Just be on the lookout for the posters and what In His Grace and Mercy is getting up to. Thank you very much to MK team, the beautiful team, the wonderful team. From myself, Dr. Kekana, Pastor Kekana, I will see you on Sunday. Thank you so much. Let me step on a few things before I leave here. Let me do this.
Over the place. We're online 24/7. 24/7. You're listening to the hottest internet station. All over the place. We're online listening to the hottest internet station.